And February is Heart Health Month, and we've all become much more aware of our heart since Buffalo Bills safety Damar Hamlin had his incident where he had his heart attack on the field and was resuscitated, and thank God he's alive. So we've got Dr. Shelley Burchsted on the phone. She is from Middlesex Health, and we're going to talk about heart health. Good morning.
Hi there. Good morning.
That was such a startling thing. Here's a person in the peak of health, just a freak accident, but the medical professionals on that field saved his life. It was absolutely miraculous.
Working quickly.
Yes, thank goodness they were all there and right on it and well trained. So just really glad that we had such a good outcome.
Yeah.
I think that would be a fantastic idea and definitely would encourage everyone to reach out to the Red Cross and check into getting CPR trained. Absolutely.
Yeah, because CPR AED training for staff and older students at your place of business, or even just for your own education at home to know how to do it properly and correctly. These are critical life-saving skills that could make a huge difference.
Yeah, definitely. Even people who are thinking about, going out and doing some babysitting, those kinds of things, teenagers getting that basic training, or new parents just kind of learning what they need to do in those sorts of settings, I think is really, really important.
Because it depends on the person size.
That's
the
correct.
CPR is very different on a baby than it is for a grown up.
That's right. So, Dr. Shelley, I'm having salmon tonight.
You are? Good for you. I'm so proud to hear that.
Heart health, right?
Yes.
We got to be aware. We've got to eat some healthy fats that will help our heart.
You got it. Absolutely. And I actually really love that you brought that up because a lot of people are still thinking that fat is bad for you. And fat is not bad for you. It's so, so important. But it's also important to look for those healthy fats. So things that are in like fish, nuts, those kinds of fats, olive oils, really, really good for you and important. The only thing to watch out for is, making sure that you're following portion sizes.
Right.
And I know my patients really get tired of hearing from me. They say, what can I do? And I say, eat your vegetables. And then they come to me and they parrot me and they say, okay, I know you're going to tell me to eat my vegetables. And I say, that's right. You can eat pretty much as many vegetables as you want, but everything else you really do need to watch the portion sizes. And of course, when you're eating the vegetables, it does matter what you put on them as well.
Well, Santa Claus brought us a couple of Mayo Clinic cookbooks this year.
Oh, what a good idea.
Yeah, so I have so many veggie recipes now, and honestly, it was startling seeing what a portion should be. And that's as soon as I bought my family pack of boneless, skinless chicken and I measured it out with my scale to 4 ounces, I was like, what?
It's not a lot.
It's not a lot.
Yeah. So do you know the visual for that?
It's like a pack of cards?
Deck of cards or your palm of your hand minus your fingers.
Exactly. Yeah. Exactly. Now,
Crazy.
You can't see me, but I'm really, really little. So if you look at my palm, it's not 4 ounces. But most people's palms, that's about right. Or a deck of cards. That's a good one, too.
And something that people don't think about with heart health is go to the dentist.
No, it's true.
Yeah.
Healthy teeth and gums can help prevent heart disease as well. So make sure that you're getting your 2 cleanings a year at the dentist.
Oh, yeah, absolutely. And it's funny, how many of my patients say, how come you're asking about my teeth? And I said, well, it's part of your health. It's in your head.
Yeah, absolutely.
But yeah, so that's a really good point as well. And don't forget the exercise.
And that's something Mike and I were talking about the other day. He was working out on his elliptical and his heart rate went up to 152. And I said, Mike,
that's a little high for someone of my advanced wisdom.
What's the right, how do you figure out what your right heart rate is for good cardiovascular exercise?
So you can actually Google max heart rate. I'm doing it right now.
Okay.
You're going to find calculators, and if you don't want to deal with the calculator, you can, do it by age. A lot of it, though, I like to think about kind of how you're feeling, even more than calculating your max heart rate. So, depending on what range you want to be in, will depend on, where you want to be for your heart rate. But like I said, I like to go by how you're feeling.
Okay.
So when you're kind of in that sort of, mild to moderate aerobic range, you really should be at the point where when you're exercising, you can't quite speak in full sentences.
Okay.
A little trouble.
You can a little trouble. So you can kind of speak like this a little bit, but I can still have a conversation.
Yeah. I test that with my music playlist. If I can sing along, then I'm not working hard enough.
That's brilliant. That is brilliant. But you're in that, mild increased heart rate when you can still sing, but you're not quite in that good aerobic range yet.
Yeah.
Once you get to that point where you can't sing with your playlist or you can't quite speak in a full sentence, you're in kind of that, moderate range. Once you're at that point where you can really only say one or two words and you're really huffing and puffing, that's kind of in that, really strong aerobic range.
And just as important as getting that heart rate up is keeping your heart rate down, reducing stress and anxiety. Get out in nature without any technology and really be mindful.
Absolutely. And, I know we're a nation of kind of media junkies. And a lot of us listen to I probably shouldn't say this on the radio.
We got it.
Pay attention maybe a little bit too much. And so, exactly. Turning it off and letting yourself just exactly be out in nature and letting everything come down is so, so important for the stress levels. Yeah.
And that's why our radio station is the place to relax and unwind. No stress here, Dr. Shelley Burchsted.
There you go.
Middlesex
Okay,
Health. It's Heart Health Month, and we really appreciate a few minutes to talk about our tickers today.
Thank you so much for having me.